Good evening. Thank you for joining us. I'm Jeff Herndon. Julia Thatcher has the evening off. Wichita's winter homeless shelter will transition into the multi-agency center in just 1 week. The facility will make the switch from mainly providing temporary shelter to becoming a year-round one-stop shop that will connect people to a wide range of services. KSN's Zena Tahir explains what healthcare providers are pushing for and where money could be a challenge. Zena?
Jeff, there is some healthcare at the temporary shelter already, but it's not enough to avoid calling emergency services. When a patient is uninsured, the county foots the bill for the ambulance. Expanding healthcare services at the multi-agency center comes with a price. At the temporary winter shelter that will soon turn into the MAC, two nonprofits are providing healthcare services. Hunter Health has a nurse.
2 days a week. They're there for a few hours each morning.
Okay.
ICT Street Teams has a staff member and paramedic there 2 days a week.
Our hope is to be able to get more people there to cover most of the hours of the day.
Both providers are hoping to expand as the shelter transitions over into the multi-agency center. Part of the motivation, cutting down on those emergency calls.
A lot of what the healthcare providers who have been going to the MAC are seeing is related to like the flu symptoms, the cold symptoms.
I mean, there's a solid majority of the calls that could probably have been handled just if the resources were available.
Right now, both organizations' services are funded through existing grants. The ICT Street Team ideally wants $500,000 to fund a care team Monday through Friday. It's not an easy number to hit in the current environment.
Healthcare funding, federal funding for grants is, there's a lot of uncertainty around that.
The multi-agency center board will take over the winter shelter come March. The board sent us a statement saying in part, quote, conversations about how to best deliver the best, most efficient healthcare solutions for multiple situations are taking place with stakeholders across the community. The board says plans will continue to take shape in the coming weeks with nothing set in stone yet. Coming up at 6, I'll have more on what ICT Street Teams does to provide follow-up care to unhoused patients and why they say it's important to shift away from emergency care and towards primary care. Here for you, Zena Tahir, KSN News 3.